It's National Women's Health Week, and there are no topics off limits as we talk with our medical connections expert, Dr. Malayev of Metro OBGYN. Let's dive back into our conversation with part two. I need to look more into this, but I don't know if you've heard of this. I was hearing that there's a book that talks about scheduling your month as a woman, scheduling your month and your meetings, and when you have your most important work, the deals that need to be done, in a business, contract deals, whatever, scheduling that around your period. So
you should definitely do that. I am the most assertive the week leading up to my period. I'm like, we are getting this done. I am not messing around. I am grumpy. I am assertive. I'm gonna say what I need, and I'm not gonna take anybody's, baloney.
Yeah. Well, and there are times too when we are more tired, our bodies are working harder at whatever it's doing. And so just being aware, having that awareness and not scheduling that really, like, I always think like once a month, I'm like, gosh, I wish I could just not have any really tough meetings this week. And funny enough, it's like there's a reason for that.
See, I don't pay attention to it. I feel like I just schedule everything as it schedules. And sometimes I'm like, oh, this was a bad idea. I'm very tired, but I'm thinking fine. I'm not that affected. I'm not a person that's that bothered by periods, thankfully, but I do get some mood disturbances the week leading up to it, but I do get a lot more done. I'm actually a very productive person in the week leading up to it because my attitude is like, take no prisoners, like just finish.
Well, and we've been saying throughout this whole episode, anyone who is having severe disruptions in their life should really come see you and talk about what could be.
And that's why we say it's a barometer. Like your barometer should be steady. Like your weather should be, some ups and downs, but you should still be able to function in your climate, in your environment. If something is now happening where you can't do that, you've got to look at why. Is it because you're suddenly soaking your pants and you're running to the bathroom at 45 minutes because you feel like you're about to make a mess in your office? You know what I mean? Or is it because the pain is so severe that even with a couple of Motrins and Tylenols, you're still not able to get through your workday? That's not normal for you. If you've previously been able to do this all your life and now all of a sudden, the last month or two or three, this is abnormal. Like I tell people, if it happens once, we can just watch it. But if it's happening every single time and you're like dreading it, you got to come in. We got to have a conversation. We've got to think about why. The FIGO people, they came up with a really nice mnemonic to help you understand like what could be causing your bleeding to be abnormal. It's literally your palm and then a coin. Palm for polyp, adenomyosis, which is that type of very uncomfortable endometriosis within the uterine muscle, leiomyoma, or fibroids, which can affect about 50% of white ladies, 75% of Black ladies. I don't know the statistics off the top of my head for Asian Pacific Islander people and, Hispanic people, but the two big groups that I see them in are, white ladies and Black ladies, and that's a lot of ladies. And then M is malignancy. So that's also not a good one. We got to make sure that you don't have any of that. And then the coin, the other part of it is coagulopathy. Like what if you're on a medicine that is making your blood thinner and now you're just like bleeding all the time and it's because of your medicine for your other chronic condition? O is for like other, there's a bunch of stuff that goes along with that one. Idiopathic, like we did something to you, etc. Endometrial factors like endometrial precancerous conditions. And then, there's some other things as well. But anyway, so there's this mnemonic and it's really easy. So we go through it right away. We do all the labs, we do all the structural evaluation. Then we talk about it like, oh, hey, we found a polyp. Like, let's take that out. You'll feel better. This is diagnostic and therapeutic.
We're coming out of Mother's Day weekend. And, so I want to talk about kind of both aspects of motherhood. As an OBGYN, you provide care and support, of course, during pregnancy and through childbirth. What are you seeing right now? Are there any emerging techniques or advancements, anything that you're excited about when it comes to whether it's prenatal care or childbirth, the whole experience?
So not much has changed in prenatal care. I mean, we're emphasizing it. Obviously, that's all still the same. There have been a couple interesting things that have kind of come and gone and fallen in and out of favor. In fact, my master's thesis was about this like grouped prenatal care for women. And it's a way for them to find community and also some peers and also still get the highest standard of prenatal care. It's typically longer appointments with more time for discussion, with like a very short private segment where, you're checking your own urine for protein and the doctor or midwife or whatever is checking on your baby's heartbeat. Your ultrasounds and all of your, invasive exams are done not in the group setting, but typically for women between like 16 and like 30 something weeks, this is a perfect idea, especially if they're low risk. So that's been around. Some places offer it. I don't know about anybody in our area, but there are places that have that. It's called centering. It's been well discussed for a long time. In terms of prenatal and maternal health, I mean, there's so much stuff on the internet. And the worst is when a patient comes in. I saw this on TikTok, like, let's talk about this. And I'm just like, okay, well, who said it on TikTok? Was it Karen Tang? Because she knows everything. You should listen to her. Oh, it wasn't her? Okay, well, then I don't know. Who did you listen to? Oh, some lady that's not a doctor or a midwife or, licensed in the field of obstetrics and gynecology. Like, maybe you shouldn't listen to her. But it's, it's a discussion point. I saw on the internet, I can't dye my hair, doctor. Why? Why can't you dye your hair? You're not drinking the hair dye. You're putting it on your roots. If it makes you feel better about yourself and improves your mental health, then you should do it. You know what I mean? Doctor, I saw that I can't exercise. Okay, well, like, don't do CrossFit and do your like crazy box jumps while wearing a weighted vest. That's a bad idea. But why can't you, walk on the treadmill or ride your Peloton or do whatever it is that you're going to do? You just have to be reasonable. And now with improving ultrasound techniques and, prenatal diagnosis and earlier stuff, we have more access to information. Like, we can do your genetic counseling. There are blood tests that the mom can have that'll tell her not only does she carry a cystic fibrosis gene, but will her baby have cystic fibrosis? Like, if you're Rh negative and you previously had to get a RhoGAM shot, there's a blood test that you can take as the mother where you can find out if you even need the RhoGAM shot. Like, if your baby's already Rh negative, then you shouldn't need it. Like, that's so cool. I couldn't say that 20 years ago. That wasn't true. What else? And then in terms of the postnatal care, again, social media is a double-edged sword. Like, you see a community, you can get support, you can get help, you can see what's normal or what's abnormal, but then at the same time, you also see all the most glamorous parts of motherhood. So you try to like think, oh God, am I not doing enough? Am I doing it wrong? Like, I didn't look pretty today and my kid and I didn't match and we didn't post an adorable selfie where our house was clean and someone else is doing that and I didn't. Am I doing it wrong? My kid's fed. I'm alive. It's alive. Everybody's okay. I must not be doing it wrong.
Yeah, safe to say those picture perfect images on TikTok and Instagram, that's not real life. That's not what it's supposed to. I mean, that's what maybe one corner of their lives.
But for every good photo and snippet that you have where you guys all look picture perfect, there are a lot of moments that do not look like that.
And if it's hurting your mental health to be on
you shouldn't do it.
Instagram, then don't do it, moms.
But I say that about every aspect of motherhood. So I have a lot of people actually that are coming in, and this has been helpful since like Chrissy Teigen talked about it. And since, some other Hollywood celebrities have talked about it, kind of being more open and more vulnerable about your maternal mental health. And everyone, finds out that like, hey, maybe breastfeeding and like being a mom is not as intuitive and as easy as I thought. And I remembered when I had my son, I was reading that like what to expect, like when you brought the kid home book and like our kid didn't want to do any of the things that the book was saying. And nothing in that book was particularly helpful. I think we tried to read it for like 2 weeks. We both tried, my husband and I. And after 2 weeks, we were like, this book's stupid. Like, this is not real life. Like, real life is like, you're not sleeping. You want to fight because you don't know what else to do because you're so frustrated. You can't fight with anybody because everybody's on the same team. And there's a tiny human who doesn't care if everybody's getting along or not because the tiny human needs something. And then, you have to think about like, what makes sense for my family unit? Is it breastfeeding? I don't know. Does it work for me? Does it make my life easier? And if it does, you should do it. And if it doesn't, I mean, I know they all say breast is best. And yeah, the breast milk has some really cool stuff like antibodies and et cetera. But if it makes you nuts, then it's not worth it. And I know that's maybe like a controversial thing to say. And I say that to all my patients, like, Have no expectations going into it. Like, don't think that you're going to walk in like all glowy and like push 3 times and like deliver like a perfect 7-pound baby and then be like up and walking around, and then your pelvis isn't going to hurt and you're not going to like pee a little when you sneeze the first 6 months after you deliver your baby, or pee a lot, depending on how long you pushed. But like, we talk about those expectations, like motherhood's not that. Motherhood is a series of surprises. Some are good, some are poop, some are less good. There's a lot of poop, a lot of fluids, actually. Everything's sticky. Don't touch anything. But like,
and
there can be no
especially
expectations. There can
no
be no expectations.
expectations. And don't let the world or society, or what you are perceiving society as telling you what you should or should not do or be, or
Yeah,
no shame, especially
no
for
shame.
yourself.
Absolutely not. And it took me a couple of weeks to kind of like figure that out, because I didn't know if breastfeeding was going to work for me. It seemed like it should. Like, how hard could it be? People have been doing it for, millennia. Okay, it is not easy. And it takes a lot of time. And if you calculate the amount of time I spent pumping, milk during my work day and during the night and on the weekends, like that's a second full-time job for a year. Like, I probably spent, 20 to 30 hours a week doing something with the milk and the feeding and et cetera. Like, that's crazy.
I also want to talk about the other side of reproductive health. As I said, coming out of Mother's Day weekend, I want to acknowledge that there are so many women who struggle to get pregnant, struggle with infertility. It's a really painful, difficult journey for a lot of families, couples,
Yeah.
women and the men who love them. Are there any factors that you want us to be aware about that can impact fertility, or difficulties in conceiving? What kinds of conversations should someone be having with you?
So typically whenever someone comes in for their screening, I say, what are your plans in the immediate future in terms of childbearing? If they say no plans, then we just make sure that they got their contraception going. If they say, okay, yeah, we're getting ready to start thinking about this, then we talk about optimizing their health. If they've got any chronic conditions, making sure that they are well managed, like their thyroid, their diabetes, their high blood pressure, that all the medicines that they're taking are safe if they were to become pregnant. We go through all of that. Once they start trying, I usually tell them, between 3 to 6 months, if you guys haven't had success, I want you to check in with me. I give them that statistic that within 12 months, about 85% of people are able to achieve pregnancy. But what about the rest of the people? So then you have to start thinking, like, what is the condition that could be causing this problem? Are they getting pregnant and not staying pregnant? Is it, something genetic? Is it something structural? Is it something else? And now, since COVID's been around, we've seen a little bit more male factor infertility. There have been a lot of studies saying that like the sperm are not swimming as well, or not having the right shape as it's supposed to be able to fertilize the egg. And so men are affected for about 6 months after they've had COVID. So sometimes people are like, oh, we're not getting pregnant. And then I say, well, when did you guys have COVID? And they're like, oh, well, my husband had it 3 months ago. Okay, give it 3 months. If after 3 months from now, you're still having trouble, then we'll have to do a full evaluation on everything. So we talk about that. We try to figure out what risk factors we as generalists can modify. Is there PCOS? Is there something metabolic that we can work on? If it's a purely, structural issue or something where it's like a male factor issue, then we have to take that factor out of it. And then at that point, we've got to refer on to the next level of care, to the reproductive specialists. And it's always the best when you get somebody that comes back from them and, they're pregnant, they're like 9-10 weeks along, and you're so excited because what a long road it's been. But then you've got the other couples, and I have a friend that I just talked to recently. For 10 years, they've gone through all of it. And now they're working on adoption because that's what's the right choice for their family at this point after 10 years of trying. And everybody is different. Everybody's family is different. And you can't put any expectations on any of it. You just have to do what's right in your family unit. And what your decisions and what your experiences have been may not be what, somebody else's experiences were. And there's nothing more frustrating than somebody who's been trying for 10 years and somebody saying to them, oh, why didn't you just do this? Okay, well, you don't think I tried that for the last 10 years, but you don't talk about it.
Right. And everyone's journey is different and unique. I appreciate what you said, that, people have to make the decision that's right for their family. We recently profiled an attorney who has focused her practice now on helping families navigate whether it's adoption or surrogacy even. And she herself and her the father of her children went through a surrogacy process. So I'll link to that.
What a
As
beautiful
well.
story for them. And that may be what's right for their family. Like, look at oh, what's her name? Kim Kardashian. Like, she did 2 pregnancies and then she said, you know what? That was a lot more challenging than I thought that was going to be. I got pretty sick. I had these complications. This is no longer the right choice for me, but I want to grow my family. Now, the difference between us and her is that we don't have unlimited resources, we as the regular people. But like, good for her for being able to figure out the correct decision for her family. And I'm sure there's a million people out there who are like, oh, she did the wrong thing. Like, she's perfectly physically capable of doing this herself, but she chose to outsource this. But at the same time, it's a choice that she made when she risked her life twice to have 2 children. Like, was it worth a 3rd risk on her life? I don't think so. Not to her.
And there are always things that are said, but go unsaid, for the people in our lives, whether they're celebrities or people we know, and each person's journey is their own. There's one other topic I want to touch on before we wrap up, Dr. Malayev, and we've touched on it a little bit throughout this interview, but it's mental health and the overall wellness of each woman. What are your thoughts? Are there specific mental health issues that you encounter or, guidance that you share with your patients?
Yeah, I do. So like I said, we talk a lot about PMDD, or premenstrual dysphoric disorder, which is the severe type of PMS. There is one birth control pill out there on the market that is FDA approved specifically for this condition, but these are the women who are getting progressively more down from the time of ovulation or the mid-cycle, to the point where, like, you read these stories every now and again. Oh, this woman like murdered everybody, and then it turns out that she started her period like the next day or something like that. That's how angry they can get. Like, I think there was a Law and Order SVU episode about it even. But
That
that
sounds
was
like a good Law and Order episode.
It was a really good episode.
But women watched that episode saying, "Oh, yeah, maybe I can."
I can see why she got so angry. Like, this story checks out. I understand now. I haven't talked much about the spectrum of postpartum depression and anxiety, but it is a spectrum. Like, I remember being a newly postpartum person, and I was either lucky or unlucky, I don't know. I had antepartum depression. I was very depressed before I had my son because I was at home. I was on bed rest. I had a condition that made it impossible for me to work. I couldn't get out of my bed. I had to sit. And there's nothing more demoralizing than being a physically active person who has a job, who has a career, who's got a dog. I can't go walk my dog. I can't go do anything. I can't bring up the laundry from the basement to fold, who is now suddenly dependent on everyone to do basic things. And that's demoralizing. And then when you come out of that on the other side, you're like, oh God, never let me go back there again. I didn't like that. And so then you have a lot more empathy again for anybody that's coming to you and is saying, I'm having these intrusive thoughts. I am having, these problems where I think that someone's going to hurt my baby. I know it's totally irrational. The baby's in the other room with my husband who loves the baby, or, with my mother who loves the baby, or at daycare where the caregiver is like texting me pictures every 35 minutes and they love the baby. But I am thinking that like a bear is going to break in and eat them. Like, what bear? We're in Michigan. I don't think we have bears down here. Got coyotes maybe, but I also don't think they're coming into the daycare. When you're having these intrusive thoughts, it's really important to discuss that with your doctor. And then you may be recommended to do some talk therapy or potentially start some medication to kind of calm down those nerve connections in your brain to help you get through this acute transition. Again, you're not sleeping, you're not taking care of yourself. Maybe you're not able to do all the self-care that you want to do. Another thing that we don't talk about too much, and it's not super common, is like postpartum psychosis. Like, I don't know if you ever saw the movie Tully, but that's a movie that every woman needs to see. It's a movie that everyone needs to be talking about. That movie came out shortly after I delivered my son. I went to go see it with my girlfriend who had a baby a few weeks after I did. And she had a little bit of postpartum depression. And we're standing there outside the theater. We thought it was about a night nanny. It was not about a night nanny, but I won't spoil the movie. But so we went to go see it. We're like, oh, a night nanny. That sounds amazing. A person that comes to your house and changes your kid's diaper and just brings it to you for a feeding. Like, what does this cost? Can we afford it? Do they have that in West Bloomfield? They don't, I don't think. Not in our budget. So anyway, we go see this movie and it's not about that. And, sometimes you just tell people like, hey, this is real life. This does happen. And my friend's standing there outside the theater in the middle of downtown Birmingham, and she's like crying. She's like, I didn't know it could get like that. I didn't know. And I was just like, it's not my place as your friend to tell you, hey, you're clinically depressed. You need to go see the doctor about this. I'm just your friend. I'm just here to support you. But like, now that we've seen this movie, like maybe let's talk about the things that could happen. So then the next day she saw her doctor. She started some medication. She's never had that problem again. She's all better, but like, she didn't know that that was a thing that gynecologists even deal with. Like, I actually just bought a textbook on women's mental health. It just came out within the last couple of years. I'm a little ashamed to say I haven't read it yet because it's, it's like this big, but I do have it. It is on my bookshelf on the list of things that I will read someday.
See, and I think that's the underlying message of this entire segment, especially as we talk about National Women's Health Week. These weeks are I don't know who makes up these weeks and the days and whatever, but
yeah,
it's a
Facebook,
really,
I'm pretty sure.
right? It's a really great time that reminds us that we need to be having these conversations, whether it's with your doctor, whether it's with your girlfriends. Just have the conversation and be open to taking whatever the next steps are. Because when we're having these conversations, I think that's also the first step, is to start talking about it. And then it's to open yourself up, to listen, to hear that, one, you don't have to suffer alone. Two, there's help available in some form, even if it's simply talking to someone like you. So I really appreciate you coming on the show, Dr. Malayev, to talk about all of these issues. There's so much more that we don't have time for today, but we'll definitely have you back to talk about more women's health issues. Again, thank you so much for joining
Thank you, Julie.
us. And that is all for this episode of Expert Connections. We'll see you next time.